Hello.
Hello.
Hello, everybody.
Hey, Octavia.
Hello.
All right. Good afternoon. Good afternoon. We are broadcasting live on our Zoom and on social media, Facebook and YouTube. We thank everybody for joining us on this afternoon as we go down to the Mississippi Delta, to the Gulf Coast, to the Golden Triangle, to share about Open Enrollment 2022. As our kickoff telethon, we're glad that you have joined us today. And we're going to be hearing from our team members from across the state. We started at 9 o'clock this morning, and then we had another session at noon with Mid-South churches. And now we're going to go with some of our other partners across the state. We're going to begin in the Golden Triangle with Brenda Wilson, and she will share some things about what's happening over there. Brenda?
Good afternoon, everybody. I'm sorry, I've got two devices going. I'm gonna stop one of them in a minute. But if you will look here, can you hear me?
Yes, we can hear you.
Okay. I have with me today, joining us is one of our affordable healthcare consumers, Miss Octavia Dickerson. And she's been a consumer with affordable healthcare for about 2 years now. And I just want to introduce you to her. She was a former instructor for East Mississippi Community College, and she's now retired. But Miss Octavia, you want to just unmute yourself and just tell them, why did you choose affordable healthcare?
Hello, all. I am Octavia Dickerson, and I live in Columbus, Mississippi. And I did retire from East Mississippi Community College. Retired a little early. Excuse my background back there. A junkie back there. But I chose to go through the marketplace, ACA marketplace, because after looking at other things, including Cobra, it was really not affordable for me. And so I want to thank Brenda Wilson, who is my navigator. Thank goodness for her. And somebody got me in touch with her, and they said, just call her anytime. It doesn't make any difference. So I think I called Brenda on a Sunday. Was it Sunday, Brenda?
Mm-hmm. It was.
Brenda on a Sunday, and it didn't make any difference to her, like a friend of mine told me, and she helped me out and talked to me and walked me through everything. And I did choose Ambetter. And the whole process was, and if I did have any questions, do was text, call Brenda, and she was right there, Johnny on the spot. So this is about Brenda for a minute, navigator. Anytime, Brenda sends messages all the time. She reminds me of enrollment. This is my second year with Ambetter through ACA. She reminds me of enrollment when we had the program where, what was that, in the Recovery Act or whatever.
Right.
And if you re-enrolled, the premiums would go down and might go down significantly. So she was quite helpful in that, because I really didn't know, I wasn't paying any attention, didn't realize that, it would help my premiums go down also. So thank goodness for Brenda on that one. As far as Ambetter specifically, Ambetter is good to me. The co-pays are very affordable. The premium, like I said, it's probably I would be paying 2 times as more than what I'm paying on Ambetter. And I think any insurance in ACA, they have to have 10 things that they cover you for, and so you're covered pretty good. I've had great experiences going to my doctor. I'm a diabetic, so at one time I was going 3 times a month, and all the labs and the doctor visits, like I said, had great co-pays, very affordable, and Ambetter is really nice. I was really quite surprised once when a concierge from Ambetter called me and asked me, was there anything that they could do to help me, or did I have any questions about anything? And they would call once a month. I'm trying to see if you have so many of those marketing calls now. I probably missed a call from my concierge by now. But anyway, I did have a question once about some medication because the price went up. And like I say, she's the concierge for Ambetter. So she said, well, I'm not the pharmacist specialist, but I will get in touch with the pharmacist and give you a list of medications that's comparable with what you're taking, but not as expensive, because the medication that I was talking about, it went from like $20 copay to $99. And I was like, no, I can't do that. And so she was Johnny on the spot again. And she sent me an email with several choices that I could make and send to my doctor. And we went from there. The whole enrollment process with Ambetter, with ACA, with the marketplace, was really easy. I like that you could compare the various insurances and that kind of stuff. So I just thought it was a great experience. And I'm not an insurance person. So, for me to say it was a great experience, that's saying something.
Thank you so much. Now, they might have a question for you, but Miss Octavia, one thing I admire about any consumer, she's a proactive insurer person. She doesn't just sit back. She's going to ask questions. And that's one thing we need to tell consumers. Don't be afraid to ask questions. No question is too little to be answered. And thank you so much. You can hang out with us, Octavia, and maybe somebody may want to ask you a question from our group.
Okay.
Thank you so much.
Good afternoon once again, everyone. My name is Thomas Robertson, and I am the Technology and Metrics Director for Oak Hill Regional CDC. And I'm going to try to keep this train moving as we move on we're going to go to the Delta this time around with Dr. Jacqueline Moore. Dr. Jacqueline Moore, could you unmute yourself and come to the camera so you can speak about the ACA in the Delta region?
Good afternoon. I'm Jacqueline Moore. I represent the Mississippi Delta. Here we have had several consumers. I wasn't able to get a hold to anybody at the last minute, but we will be offering services. You may contact me at 662-931-0550. We are here to help you and navigate you through any information you may need. Thank you.
Dr. Moore, tell us a few of your good things that's happened when you signed someone up for the ACA with your time.
When we are ready to sign you up for the ACA, we will do a consent form with COVID-19. If you allow me, I will send it to you via email if you can operate that way. If not, I will put it in your mailbox and pick it back up. And then I will contact you by phone and we will proceed with the application. I can meet you within a local library and ask that you wear a mask and work with you one-on-one. I'm also available for any events you have, as long as we are COVID covered, and that include a mask and sanitizer.
What are you looking forward most to about this year?
This year, I'm looking forward to contacting people who are not covered, or either helping people who are covered and going over their changes if they need any, and making sure that they meet the 10 essential benefits that's required by insurance. And I would love to do some events and grow the Mississippi Delta and help cover our uncovered citizens here, as well as work with Medicaid and CHIP people.
If you could name all the 10 essential health benefits, could you name them? What do
Not
they
off
all
the top
plans
of my
cover?
head. I don't have that list available with me, but I
I'm going
do
to
have
help
a
you out.
list
I
of
got it right here for you. Let me
Okay.
just give everyone a brief breakdown of the 10 essential health benefits. We want to make sure that people understand that all plans through the marketplace cover these 10 essential health benefits.
Okay, we want to make sure that they cover the ambulatory patient services, emergency services, hospitalization, pregnancy, maternity, and newborn care, just to name a few of them.
What about pre-existing conditions? Are those covered?
Yes, they are.
And what kind of, when someone's coming to you, what do they need to bring to enroll?
When you come, you need to have a valid ID and just general information, which we call personal information. And with that, we're able to go into the marketplace and apply. And in applying, we're able to tell whether or not you will be qualified for any monetary benefits to help you with your premium, or whether you will have to pay it off. I've had some cases, I must say, where people interesting. We have an echo. Okay, I've had some places where people didn't have to pay. I've had some consumers, should I say, where people had to pay zero. Their entire premium was paid for them. And I've had minimum as well. I've covered some retired people who have switched from COBRA. As Brenda said, they retired out the education system, and we were able to find a cheaper plan for them as well.
Are you selling the insurance for Get Covered Mississippi, or are you just educating?
No, I'm not selling. I'm only facilitating in the marketplace. I am not an insurance salesperson.
So say that one more time, just in case somebody didn't catch it the first time.
I am not selling. I'm only facilitating for the marketplace. I am not a broker. Neither am I an insurance sales agent.
And could you list your areas you're working in, your contact information again, if someone missed it the first time?
I will be working with Washington, Sunflower, Bolivar, LaFleur, and possibly Issaquah County.
Great. And what's the start date, the end date, and for open enrollment for 2022?
Our start date is November the 1st, and we'll be going through the first part of December.
So let's break it down. So today is November 1st, so that means the ACA, the healthcare.gov opened up for open enrollment. And the last day to enroll for this year is January 15th. But if you want to have coverage by January 1st, you have to be signed up by December 15th. So let's just make sure everyone makes note of this to our online audience, that today is November 1st, and the marketplace opens, enrollment starts today. It goes until January 15th for coverage for 2022, but you must enroll by December 15th if you would like coverage to start January 1st of 2022. And that's pretty much it, Dr. Moore. If you have anything else, final words you would like to say?
I am reachable at 662-931-0550 or Jacqueline Moore 19 at yahoo.com.
All right. Thank you so much, Dr. Moore.
Excuse me, can I jump in there and say something for a minute?
Sure, we have a question from Ms. Dickerson.
Right, not a question, just wanted, since I'm a consumer on here, just wanted to emphasize, like she said, Brenda's a navigator also, and she never encouraged me with either any insurance one way or another. She just helped me, guide me through the whole enrollment process. But she did not try to sway me to either insurance. I think now they have more than, maybe the first time it was just Ambetter, but they do have more insurance in there now. And in different coverages, the silver plan, gold plan, bronze plan. And just wanted to emphasize, like she said, navigators. I don't know, Dr. Moore, are you a navigator also?
Yes, I am.
Okay. Well, I just wanted to emphasize what Dr. Moore and my navigator, Brenda Wilson, said, since I am a consumer, didn't try to sway me any kind of way, just guided me through the enrollment. And I appreciated that. That did ask me some questions, or had some questions in mind that I should ask myself and answer for myself in helping me better choose the plan I wanted, but did not try to sway me to any plan. Just wanted to throw that in since I am a consumer.
Thank you.
That's great. We love to hear from our consumers about this. But as far as Mississippi this year, we have three plans that you can choose that Mississippi offers this year. It's Ambetter, Molina, and Cigna. Once again, though, the three plans that Mississippi offering during the ACA is Molina, Ambetter, and Cigna. Now we're going to shift gears. We're going to go down to the coast with Mr. Danny. Could you unmute yourself?
Yes. Good afternoon, Duke. Good afternoon, Ms. Octavia and Dr. Moore. How are you guys doing today?
Hi, Danny.
Hi. Yes. This is our 9th year working with Oak Hill on OE open enrollment for the marketplace. We've been fortunate to collaborate and partner with Oak Hill, provide support and financial support for us to help the Vietnamese community here in the Gulf Coast. We basically provide service to the Vietnamese community reside in 3 counties, Jackson, Harrison, and Hancock counties. We have approximately about 10,000 Vietnamese live in this area. So it has been a great support to allow us to help our community members sign up for the Affordable Care Act, which is a godsend. As you know, most of our Vietnamese community here live right above the poverty level. There's no way they can afford health insurance on their own. And most of the people work in the seafood industry where there's no health insurance that benefits at all. So without the Affordable Care Act, prior to the Affordable Care Act, 65% of community members don't have insurance, which means that they never see the doctors or see anyone else unless they are really, really sick. And in many cases, by that time, it's a little too late for them in case of, there are some chronic disease. So over the past few months, as we ramp up, get prepared for OE9, we go to the community, talk to community leaders, faith-based organization leaders such as the church and the temple here, talking about the new enrollment period, and we encourage all community members, all constituents to sign up. We do have a database of a client that has been signed up in the past, but we reached out to the people that has not been has the opportunity to sign up before. So this is a great opportunity. This is the first time in Mississippi we have 3 healthcare providers that participate in this program. Usually we have Mr. Molina or one point United Healthcare, and then we got Ambetter, but there's never 3 different healthcare providers participate at the same time. So this is great because we have the opportunity to pick the one that is best for you in terms of the price and the coverage. Whereas in the past we don't have that opportunity. We just pick whatever is available, and usually those coverage were not really conducive and meet the needs of our community members. This past Sunday, I went to the churches, to the temples, and I went up there, I asked the priest and the monk to give me about 10-15 minutes after Mass so I can talk about this program to the constituents. It was great. I informed them that the enrollment period started on November 1st and ended January 15th. So anyone who needs insurance need to sign up. You can come out to our office. We're open from 9 to 5 every day, and and we are available on weekend as well, just in case if people couldn't get here during the working hours. We have to find a way to accommodate our community members because many of them work in odd hours. They work in the seafood industry. Sometimes they're working from 2 o'clock in the morning to 10 o'clock in the evening, in the morning, and sometimes they work from 3 in the afternoon to like 7 or 8 in the evening. So their schedules are very, I would say flexible, but it's very unconventional. Whenever there's things to do, they just show up for work. So we try to accommodate our community members by having, the weekends or even late hours as well. I just want to mention that, our community members have very limited English proficiency. In other words, is that they cannot get on the website to apply or to sign up themselves. They need assistance. So that's what we do here is that we usually get the client come to the office. We sit them down, we explain about ACA, the consent form, and then, we go through the application process. In many cases, these people don't have an email address. You have to have an email address in order to sign up for the account on the marketplace. We have to create, an email account for them, and then and the marketplace account as well. And then we go into the application. We go page by page, paragraph by paragraph, and sentence by sentence. Explain to them fully so they can have an informed information, so they can make decisions is best for themselves and for their families. So usually for English-speaking client, we can maybe an hour we can go through the application. But for the non-English speaking clients like our clients, it takes about 2 or 3 hours per person in order for us to go through the application process. And when we, and then toward the end, we have to explain to them a different health coverages, different plans that fit best to their needs. So for us, it's a little more time spent with them because of the language access. But like I also mentioned, so this past week on Wednesday, we also had a workshop. About 20 people showed up, and we talked about ACA, what to expect, what information do they need to bring to our office if they want to apply for, sign up for the marketplace. So we provide every information available for them, so they would know what they need to bring to the office when they come in to sign up for the marketplace. We make ourselves available. We got 3 certified navigators in our office, and they all can assist anyone who needs, whether it's renewal, change of plans, or first time sign up. So we'll make ourselves available to everyone, not just the Vietnamese community, but we also serve all the ethnic groups as well. We do have a small percentage of Chinese, Laotian, Cambodian in this area too. So the past OE8, we serve, not only Vietnamese, but like I mentioned, we have the ability to serve everyone who needs the assistance for sign up there with the marketplace. So, if you know anyone living in the Gulf Coast that needs the assistance to sign up for the marketplace, please refer them to us. Our address, our physical address is 181 Lemieux Street in Biloxi, and our phone number is 228-436-9999. So we're looking forward to assist anyone who needs the assistance to sign up for the marketplace. And I'm excited about this year because of the 3 different insurance providers that are participating in this this year. So this gives our consumer or clients the opportunity to choose different plans. And as you know, competition drives down the price. So the more competition it is, the better for the consumer in terms of the premium.
You brought up a key point, Brother Danny. This premium, what is this tax? What is this tax credit at? Say I'm a first-time consumer. What is this premium tax credit that everyone keeps talking about? What are the savings? What are those options?
Well, usually when you go through the application process, you input your income and numbers of household, and that, and then that will determine the amount of tax credit you will receive from the marketplace. So the higher the income that you are that you had, the lower the tax subsidy. I mean the tax subsidies that you receive for your premium. So we explain to our clients, they need to project as close as possible for 2022 income by the end of the year. The closest to your projection, the better off it is. But if you project it too low and then you make it too high, you may wind up paying back to the marketplace. So we're working with them. We explain very details about the tax subsidy for them. So, once you put your application and put all the numbers into the application, they will determine the amount that you receive toward your premium, and then they can choose all of it or can choose part of it. But most likely, all the consumer choose all the tax subsidy that they receive, or they're eligible toward the premium, and that will help lower their premium per month.
Okay, so who do you include about further in your household? What do you include in that when you're trying to fill out the application for the first time?
We include everyone who's on the tax return.
On the tax return, make sure you tell everyone again that
they need to, whoever in your tax return is considered your household. So even if you have 5 people tax return, only 3 people applying for ACA, you still have to include all the people in your household. But you only check the number the people that you want to apply for for ACA. So yes, it's important that they need to include everyone that will be on the tax return for 2022 in order to get the correct amount of subsidy that they receive from the marketplace.
Okay, and tell us again about these 10 essential health benefits. We want to make sure that everyone knows about these 10 essential health benefits.
Wow, you put me on the spot right now. I know that,
I'll help you out. I got them right here. I can change my background. We want everyone to know about these 10 essential health benefits.
Okay, ambulatory patient service, emergency services, hospitalizations, pregnancy, maternity, and newborn care, mental health and substance abuse, prescription drugs, which is important. Most of the community members have some chronic disease, so they have chronic, medication management every month from the doctors, diabetes, high blood pressure, hypertension. So prescription drug is very important. They have to have it in order for them to maintain healthy. Rehab services, laboratory services, X-ray, blood work, CAT scan, MRI, all that's we cover under this. Prevention and wellness, which is, you can have up to 2 wellness, checkup with the doctors a year without paying out of pocket. No deductible, no out of pocket cost for preventive and wellness services, and pediatric services. For newborn, for mother who's about to have children or any family that have children, pediatric care services is really important. So these ACA will cover all 10 essential services that I just mentioned.
Great. We want to make sure that we continue to spread about the 10 essential health benefits. And Brother Danny, could you list your contact information for everyone again who may not
Absolutely, yeah. We can be reached at 228-436-9999, and our office is located at 181 Lamuse. Let me spell Lamuse. Lameuse Street. That's in Biloxi, right downtown Biloxi, Mississippi. And our office hours from 9 to 5, and we do accommodate any client that does not come into office during that convention hour. So we usually stay back a couple hours after work, or we do have a weekends just to accommodate for those who cannot come in during the weekdays.
Great. Thanks again, Brother Daniel. If you could just stick around, we're going to come back again as a
absolutely. I'll be here and I'll answer the question people have, that they may have for me. But again, if you live in North Jackson, any Delta, any other region, and anyone who lives in the Gulf Coast that needs assistance, like I say, our target community members is Vietnamese American, but we serve more than that, just the Vietnamese American. We have the ability to serve other ethnic groups as well. So if anyone that needs assistance, please send it to us, and we'll be more than happy to assist them. We have 3 certified navigators, and I think the 4th one is the process of getting the 4th one. So we do have capacity to really help a lot of people who needs health insurance for next year, for 2022.
Great, great. Thanks again, Brother Danny. And
No problem.
we're gonna continue on since we're down in the Gulf Coast. Let's see. I think we have a representative from Mercy Housing on here. Ms. Song, could you, if you're able to jump on and give us a few things about Mercy Housing? I think that's, hi.
Hello. I was not expecting you to call me. I was on the call and I was like, la 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 la. I was like, la la. Hi, my name is Song Tran. I am the ACA navigator for Mercy Housing and Human Development. We are located in Gulfport, Mississippi, but like Brother Danny says, we serve the whole Gulf Coast, which is Harrison, Jackson, and Hancock County. So that's all the 3 counties that are in the Gulf Coast. So we're really excited to be here, and we've been doing this years. It feels like a long time. Like, you know how like at a certain, when you're like a certain age, someone asks you, how old are you? I'm like, I don't know, I'm just old. It's been a long time. So I feel like I've always been a part of the Get Covered Mississippi team for like years now. So we're very excited. Here at Mercy Housing, besides doing the ACA enrollment, we also do the VITA as well. And VITA is the free tax preparations as well. So we incorporate those 2 things together, especially when people are trying to file taxes and they have questions about their 1095A forms. And there's a lot of things that go involved in it. So we work with that hand in hand.
Perfect, perfect. What are you most looking forward to for this open enrollment season? Do you expect a big number to show up to you guys this year?
Oh, yes, definitely. People are really excited. And now that we have 3 players involved, that changes everything, right? Danny mentioned that there's competition. So when there's competitions, it's always good to be on the other side of the end, right? When there's competition and you get to pick the different options. So we're very excited. We also serve the Vietnamese community. I'm one of the bilingual ACA navigators. So yes, we serve the Vietnamese communities and different communities around us. So we're really excited. So last year, with the pandemic coming around, we did virtual appointments. So that was very different. So we're excited to continue to do that, as well as have some on-site appointments as well.
Great, great. So could you list your contact information again? We're going to make sure we get this contact information embedded in everyone's head. So if someone's down there, they can contact you guys.
Great. I'm going to put it in the chat.
All righty. And once you put it in the chat, I'm going to read it off. And I think, Ms. Brenda Wilson, are you still on?
Yes, I am.
Okay. I'm sorry. I didn't get to ask you. What are you most looking forward to for this open enrollment season?
Well, I'm hoping we'll have an outpouring of consumers who will need our services, and we can see a lot of people get the healthcare coverage that they need to have a better quality of life. Early on, I was listening to Reverend Montgomery talk about the fact that, it's a faith-based organization. We know we have our faith in the one who really heals, but with good healthcare coverage, it does help one to have a better quality of life, because you're able to seek out assistance from medical facilities, medical providers, if you have a special health need, you get your prescription drugs covered. So I'm looking forward to making sure that the consumers in the areas that I serve will have that information. And as they need me, I'll be available to assist them and provide the information, as well as help them to get into the marketplace and get the affordable health plan that they can have for them and their family.
Okay, is there anything else you want to add for, as far as, because you are in the Golden Triangle area, correct?
My contact information.
Okay, yeah, please tell us your contact information. For those of the ones that's in the Golden Triangle area, please contact our certified navigator, Ms. Brenda Wilson. And Ms. Brenda Wilson, you can list your contact information.
I'm going to give two numbers. The office number is 662-298-3584, extension 106. And you can call, that is the Oak Hill Regional Development Corporation's office number. And also they can call my cell number, which is 662-574-2470. As has already been said, I'm set up at a local church here, which is in the heart of our community, Northside Missionary Baptist Church. We're in the fellowship area, and I'm available Monday through Thursday here at the church, and by appointment on Fridays and Saturdays. But we're here from 10 to 4 on Tuesdays and Thursday, and 12 to 4 on Mondays and Tuesdays, excuse me. Wednesdays and Thursdays, we're here from 12 until 4 p.m. So, but we are always available by phone. So it's kind of like you're 24/7, really.
Yeah. And also, since Son has put her information in chat, I'm gonna list that information.
Okay, we'll do that.
Son, your information, she works for Mercy Housing and Human Development. The address for that is 1135 Ford Street, Gulfport, Mississippi. The zip code for that is 39507. The office number is 228-896-1945. And the fax number is 228-896-1347. And her email address is xphan@mhhd.org. Son, did I get that correct?
You nailed it.
Now, if everyone, all of our panelists could come back on the video, we're gonna just have an open discussion for the last few minutes. I'm gonna spotlight you guys. And we're just gonna go through a few examples. And Ms. Dickerson, you're more than welcome to chime in since you've been with the program for a while. I see. You know more than me about this stuff. Let's see. Yeah. Well, before we do that, someone just walked in my office, and one of the people that knows a lot about the ACA. I'm gonna let him speak some more on it.
Good afternoon again. I'm Pastor Montgomery, and for the ACA, it's a great opportunity. No matter who you are, you have an opportunity. If you do not have coverage, at least give us an opportunity, or give someone an opportunity to share with you the information that we have. Many times we compare what other people results are because our neighbor, they may have 2 children like we do, and sometimes they don't qualify, but everybody's a little bit different. So we encourage you, if you do not have health insurance, please contact us so that we may be able to share the information that we have, and you can compare it and allow the system to tell you what you can and what you cannot be qualified for. Do not just go on what someone else says, or though you do not even doubt the system, but give us an opportunity to share what we can, and so you can make the choice from that within yourself. Thank you so much.
Thanks again, Pastor Montgomery, and we're going to go back to our panelists. I just have a few questions about it. So, say I am a 21-year-old dependent living with my parents and going to school full time. I'm not married and have no kids. So do I apply for health insurance as a household of one and list only my own income, or do I have to be on my parents' insurance? And Brother Danny, Song, Ms. Brenda Wilson, you guys are more welcome to all answer that question.
If they are playing by their parents, they will have to use their parents' household information. And what we found is that a lot of the college students are being covered. So it has worked out well for the ones that I've seen, the young millennials.
Hey, brother Duke, from what I understand is that if you're a student and you're in school, and I think you could still be on your parents' insurance after 26 years of age, and you're still in school by then. From what I understand, as long as you're still in school, you can be covered under your parents' plan.
But what we have found too, Brother Danny, there are some people who the parents found it's more expensive for them to carry them on their plan, and they switched them over. If they're on the state health insurance plan as children up until age 19, they have actually gotten plans for them, which was much, much cheaper for that parent.
Right. I mean, that's absolutely right. But the thing is that, once you pass 19, you'll be phasing out of Medicaid or just program. Then you have to get into either, the ACA or your parents' plan. If you're still in school, you still can be on your parents' plan. Unfortunately, if you want to be on your own, you have to have a job and have to have an income in order to qualify for ACA. If you don't have an income, then you're not qualified. You have to be under someone else's plan.
Right.
Brother Duke, if you say something, you're on mute.
I'm sorry. What is there? Let's ask about this. Is there a penalty for being uninsured?
No, not anymore. I think that has been, removed. So there's no, if you choose not to have insurance, that's up to you. You're risking your life in case you get sick, but there's no mandate. There's no longer a mandate like a couple of years ago where you have to pay, a penalty for not, having coverage. But since then, they removed that. So there's no mandate, no penalty. It is all voluntarily. If you want to have it, great. If you don't want to have it, it's up to you. And then, chances are, if you get sick, you have to pay out of pocket if you don't have insurance.
Okay, what about, so say you applied and they're telling you, the marketplace is telling you that you need to send forms in, like your income forms. How would you go about doing that? Could one of you guys explain that to our online audience?
Right. So when you submit, when you enter information application, they'll ask for your income. But toward the end, once you complete application, they may ask you, they need to see proof of income, or let's say you put in $30,000 the projected income for 2022. So they want to see proof of income. So you can either send them your last year's tax return, or add W-2, anything that show that on W-9 or 1099, whatever income that you received from last year, to show them. There's two ways you can send them. One, you can upload your document into a portal, going through your application, and your online application, there's a section where you can, click on it. There's a menu, you can click on upload documents, or if you choose not to, you can send them to the marketplace via, postmail.
Don't forget, we can also fax it as well.
Yes, you can fax it, but the thing is, sometimes, there's no proof that they received it. I have situation where we fax it to the, information to them, and then 2 weeks later, they send another email and say, we still haven't received your documents, and you have such X amount of day before we terminate your application. So I think the best way is to by mail, using certified mail, where there is people have to sign for the return, like a certified mail, or you can upload it, which is you can always refer to when you have uploaded there, you receive a notification that you have uploaded documents. So there's proof that you actually upload document into the systems.
And it also helps with privacy, because you don't want your information to go to the wrong place.
Oh, you just made a valuable point, Ms. Brenda Wilson. This privacy information, what do we do for when we're helping a consumer? Do we have them, we just get their information and put it everywhere, or how do we go about that, protecting people's PII?
We protect their information. As a matter of fact, when they sign the consent form, on the consent form, it shares with them how we will handle their personal identifiable information, or PII, and we keep it under security. We keep it in a place where it's safe and away from anyone else who should not have access to it. And those documents are kept on file for up to at least 6 years. And it is kept secured because even if we have information on a technical item like our computers or whatever, we protect those items, that information on there as well.
Great, great. So once again, I'm say that I'm a new consumer and I get my eligibility notice. What is that? What does the eligibility notice tell the consumer?
The eligibility notice, first of all, it tells them whether or not, of course, if they're eligible for the affordable health care coverage in the marketplace. And keep in mind, even if somebody is eligible to go in, but they don't get a reduced premium, that does not prevent them from buying a plan in the marketplace. It also will indicate the amount of tax credit, and it will give them information about what their next steps will be. And as you stated earlier, would also ask them if they need to supply additional information to complete the application or to verify income or other information about their household.
Okay, Dr. Moore, do you have anything you want to add about the eligibility notice, or Brother Danny or Son?
Well, basically is that I concur, I echo what that was said about eligibility notice. Eligibility notice also tell you how much you are eligible for tax subsidy going toward your premium as well. So you look at that based on your income, what you put in the application, then will determine the amount of tax subsidy you receive toward your premium when you choose a plan. So basically that's what it is to let you know that you're qualified for ACA and that how much is the tax subsidy toward helping you toward paying for your premium.
Brother Danny, you brought me to my next point. The plans. What it was, like I say again, I'm a first-time consumer. Those
Right.
plans, I see that there's a silver, I see that there's a bronze, I see a platinum, I think it's gold, red, white, and blue.
Right.
Can you just fill us in? Could everyone just fill us in about those plans?
Well, right after you do the application, you call it, and you get a qualification, and you get eligibility notice, how much you qualify for tax subsidy. The next step is choosing a health insurance plan. So there's like Duke say, there's 3 or 4 different plans. The lowest is the bronze, then you get a silver, the gold, a platinum. So as you go up onto the level, it's gonna cost a little more. It means that the higher the premium, the higher the plan, the more coverage it will cover, for you. So it's best for us to look at each plan and explain to the consumer what does each plan cover, how much is deductible, how much out of pocket, percentage of coverage when in hospitalization, how much the plan will pay in case if you are being hospitalized, and what is their their pay and how much you're responsible. So as you go higher into a different level plan, the coverage is a little higher, but yeah, you have to pay a little more out of premium. So look at all that and you explain to your consumer and then let the consumer decide what's best for them, what they can afford. So it is a very tedious task where you have to really go line by line, plan by plan, give them side by side comparison so they can see what is best for them, what is the most affordable care for them, and what is what kind of plan meet their needs for themselves, for them and their family.
Did any of our other panelists want to add anything before I ask the next question? Okay, we're going to move right along. What happens if my income changes during the course of the of my plan during the year? What happens then?
If your income changes, it's really, really super important that you notify the marketplace, and you can do that by calling them, letting them know, hey, there's been a change in income. Because if you do not notify them ahead of time, when you get that fancy little paper called 1095A form, and then you do your taxes, there might be some subsidies that you're gonna have to pay back. So it's really important, especially if you're self-employed, but being a self-employee, your income fluctuates all the time. And something that Brother Danny said was, trying to estimate as much as possible, but then looking at your income, maybe like towards the beginning and then half the year, like towards the middle of the year, figuring out, okay, do I feel like I've reached that level yet? Or maybe let me go update my application.
Wow, valuable information that's been given today. What are the self-employed individuals? What about them? Are they left behind?
Can you repeat the last thing you said? We couldn't.
The self-employed individuals. How do they go about getting insurance through the marketplace? Are they available? Are they able to get insurance through the marketplace if they're self-employed?
Of course, everybody. I wasn't saying everybody, but everybody who meets the requirement, right? So yes, self-employees are able. It's a little different, of course. We don't get that fancy W-2, so it's a little different when it comes to estimating your income, but they are still eligible. They're still eligible, and there's a little bit work when it comes behind doing it, though. But they are definitely eligible.
Great. Ms. Dickerson, can we go back to you for a minute? Our consumer that's on the line. You're muted. You're muted, Ms. Dickerson.
There you go.
What more advice would you give someone who's contemplating about getting marketplace insurance, but they just need that extra push? What would you tell them?
Check it out. Go in and look at it. You'd be surprised. And that's what I was talking about, the 10 essential things, 10 essential coverage, 10 essential elements. Did I say it right?
Benefits. Mm-hmm.
Okay, 10 essential benefits. Pretty much that's what you're going to need. I was one that had a pre-existing I'm diabetic, and I was diabetic before I got this insurance, but I don't think it affected it that much. I was glad to hear that you had one more insurer to cover. Like you say, competition creates lower prices. So I'm gonna go in there and just look and see. Now, what I did notice, I pulled up Ambetter, and I hadn't been there for a while. I pulled up Ambetter while we were on the phone. That's why I'm looking this way. And it was really nice to know if I did not have anything different for 2022, it says that I'm covered already. I won't have to go in and re-enroll or anything this year.
Amen.
You just keep going just like you are. You don't have to do anything. I think that's wonderful.
That is so great. To our panelists, there's another question that just came in. About I had health coverage for 2021. Do I have to renew, or does it automatically renew for me?
Based on what she was just sharing with you, you'll get what they call an MOEN, and it's an eligibility type notice. It's not the eligibility notice itself, but it will let the consumer know that it's time for enrollment 2022. And as she stated, if there are no changes to be made, then you don't have to do anything. It will roll on as always, but they will indicate if your premium will go up, or if it remains the same or go down. So one good thing about it is that once you enroll, they will follow you all the way up until you either age out with Medicare or some other type healthcare insurance that you may acquire.
And I'm definitely going back in and look, even though it will roll over, because you do have another, like I say, insurer in there. So I'm going to see what kind of prices everybody got in this time. Again, I'm not going to just let it roll over. Well, it may just roll over because I might find out, and I'm satisfied with that. But I'm definitely going in there and look, because we got another one, like you say, Molina was in there last year, but now we have another Sigma. So that's great. I'm going to go in there and look and see if I want to change anything or not. But anytime that, if you do have some changes, it's real simple to do it. And they just walk you through it. And if you have any questions, all you got to do is call a navigator in your area, and they will walk you through it, because I know Miss Brenda Smith will definitely do it. And from listening to everybody else, I think everybody is so helpful and so knowledgeable about this product, about ACA in the marketplace, that it is wonderful.
Thank you.
If the word needs to get out to everybody, because this is great. This is great. And like I say, the navigators are so great. I can see that they really believe in what they are doing. So that's a wonderful thing. And I thank all of y'all. Thank y'all.
Thank you so much, Ms. Dickerson, for coming along and agreeing to be a part of our 3 o'clock Telethon session. We're gonna have our final thoughts from everybody. So we're down to our last 4 minutes. So once again, could all the panelists just show their face and unmute themselves and just give their contact information and their final thoughts, and we're just gonna call it a session for today until 6 o'clock. So we're gonna start with, I see Son first, so you're more than welcome to give us your contact information, Son, once again.
Again, my name is Song Tran. I am the ACA navigator for Mercy Housing and Human Development. Our address is 1135 Ford Street in Gulfport, Mississippi, 39507. Our contact number is 228-896-1945. And then I will be dropping it in the chat box as well if you need it. So I'm really excited. Please give us a call. There is no harm. It's not like we're not gonna be one of those car dealerships where you go and you're scared because those dealers are gonna try to come and talk to you and try to make you buy a car. No, we're not gonna be doing any of that. We want to help you, and that is our goal. So thank you.
Thank you, Son. And Brother Dan, we're gonna go to you to give us final thoughts and contact information.
Yes, our contact information is, our address, our office address is 181 Lemieux Street, Biloxi. Our phone number is 228-436-9999. And we're looking forward to help anyone who needs assistance to sign up for the marketplace for the ACA. We're looking for a very successful and, great, OE9. And again, give us a call. Like Sun say, we're not insurance agent. We're not working for commissions. We're here to help you. There will be no service charge at all. We're here to provide any information you need so you can make an informed decision for you and your family.
Thanks again, Brother Danny. And we're going to go to the last two, Jacqueline Moore and Sister Brenda Wilson.
Good afternoon. Again, I'm Dr. Jacqueline Moore. Contact information is 662-931-0550, and I will meet you at any public library. If all else fails, you can contact me at Mississippi Delta Community College, and someone will put you through. Thank you.
And this is Brenda Wilson from the Golden Triangle area. I'm working out of the North South Missionary Baptist Church's fellowship area, 1501 9th Avenue North, Mondays through Thursday. The hours are 10 to 4 on Mondays and Tuesdays, 12 to 4 on Wednesday and Thursdays, and by appointment on Fridays and Saturday. The contact numbers are 662-298-3584, extension 106, or you may contact me at 662-574-2470. And I would like to say, let's make sure that everyone in your household is covered. We have to get car insurance to maintain our vehicles, or to help us in case we have accidents or incidents, I should say. We also should protect our lives and have a quality of life by getting affordable health care coverage.
Thank you, everyone. Again, my name is Thomas Robertson, and I'm the Technology and Metrics Director for Oak Hill Regional CDC. And I thank you guys for sticking around with us for our third session of the Open Enrollment Telethon. And before we close out, I'm going to turn it over to our project director so she can have a few words to say. Sister Lottie Minor.
Hello, everybody. Hello, everybody. Hello, team Golden Triangle and team Mississippi Delta and team Gulf Coast. You guys have done a great job in sharing with our friends across the state about what we offer here at Get Covered Mississippi. And I am just so excited about today and about all the work that we're doing. We have one more segment of our telethon coming up tonight at 6 o'clock, and we're going to focus on some of our assisters, or rather some of our navigators who also work as assisters and family service workers with our Head Start centers here in part of the state. So remember healthcare.gov. Remember our website there, if I can get out of the way, www.getcoveredms.org. Phone number 662-298-3584. We are here to help you, and we are just having a ball on day one of open enrollment. Thank you all. Thank you all. We are going to sign off now for a little while, and we'll be back at 6 o'clock for the rest of our telethon. Have a great evening, everybody.
Thank you, Sister Lottie.
Bye, everybody.
Bye, everybody. Thank you, Sister Octavia.